back to Houston Life. Turning now to our health and an important conversation for expectant mothers. Tomorrow, April 11th, kicks off Black Maternal Health Week.
Yeah, according to the Centers for Disease Control and Prevention, Black women are 3 to 5 times more likely than white women to die from pregnancy-related complications and more than twice as likely to experience severe maternal morbidity. Joining us now is Dr. Esohe Faith Ohuoba, an OB-GYN and Medical Director at Memorial Hermann Medical Group Northeast. Dr. Ohuoba, welcome to the show. I'm glad we're chatting about this.
Thank you.
Why does a disparity like this exist, first of all? Why are Black women more at risk?
That's a great question. The reality is it's a complicated situation. You have structural racism, you have lack of access to care, barriers to care, and also the issues of chronic stress going on in Black women that contributes to this. So it's complex.
It is complex, but I want to make mention, let's clarify, what is low risk versus high risk pregnancy?
Great question. So low risk pregnancies are pregnancies that really have no other morbid issues, right? No
other diseases, essentially.
Right? Like hypertension, diabetes, for example, that would be classified as low risk. And then on the opposite spectrum for high risk, unfortunately, being over 35 years old is a high risk factor. And then also having the other comorbidities, right? The hypertension, diabetes, even sometimes asthma, for example, will classify you as high risk.
And what are things that Black women should know about these risk factors before trying to conceive?
Great question. So I know a lot of times in my practice, and just in general, your OB should be encouraging you to get as healthy as possible, right? Minimize the risk that these comorbid conditions can have on your pregnancy. So lose the weight, eat healthy, seek out an OB-GYN. You can also do pre-conception counseling. So when you're thinking about getting pregnant, you can actually consult with your OB and have a conversation about what would be the best next things for you to do.
So essentially, like, let's say you're pre-diabetic. If you take the time to drop a bit of weight and reverse that situation, you will potentially have a better outcome.
Exactly.
When you do decide to have a baby.
And the same concept with hypertension, right? If you have uncontrolled blood pressures, making sure you're on the right blood pressures and getting that together as well.
So why are these rates rising so quickly?
Again, complex.
It's a long answer, I know. It's a general question for a lengthy answer.
So, and again, it is complex, not just the medical side, but like I touched on before, because of the implications of racial disparities and racism that contributes to it. Sometimes women have delayed access to care. Sometimes they don't know that they're actually pregnant. And then also the concept of just getting adequate care, right? And that's where implicit bias comes into play, where Black women may be talking about and describing their symptoms and they may not be heard, right? So that concept of implicit bias plays a factor into these rates rising.
Also, we were chatting, just our team upstairs at Houston Life, we were chatting about all the different resources Memorial Hermann has in place, resources and partnerships to help people access care. Here's a list on our screen right now. And these are things that no matter where you are in the Houston area, if you have questions, some of these resources on your screen can make a big difference.
Yes, I definitely agree. So Texas AIM is an initiative that is with Texas Public Health Department that has various quality initiatives addressing hypertension, hemorrhage, as well as thromboembolic diseases, clots and things like that. March of Dimes has been very great with Memorial Hermann in terms of actually having implicit bias training for the nurses and for the doctors as well.
And even fatherhood programs, parenting classes. So these are all things that I hope our viewers will take notes on and visit you. Final thoughts, doctor, for anyone out there who is thinking about having a family and maybe a bit overwhelmed by all the things that can potentially go wrong.
I would definitely say select your OB-GYN carefully. Make sure you have a trusted relationship and make sure you feel heard when seeking your care so that you can have a great pregnancy experience and outcome.
Is there a waiting list to come see you?
She waits for patients to get off flight. She calls them in the middle of the night. It sounds like you are definitely one to call.
I'm busy.
You're busy. Okay. Well, Dr. Esohe Faith Ohuoba with Memorial Hermann Medical Group Northeast, thank you for stopping by Houston Life.
Thank you.
It's great to see you. And Lauren Kelly, thanks you for wearing
for twinning
a matching
today.
outfit. Also, in recognition of Black Maternal Health Week, you can learn more about what Memorial Hermann is doing to eliminate racial and ethnic disparities and to end maternal morbidity by visiting their website, memorialhermann.org/maternal-EDI.